Welcome doctors. Running a medical practice these days can feel like juggling flaming swords while walking a tightrope. Between packed schedules, endless phone calls, insurance headaches, and the never-ending pile of documentation, it often feels like there's just not enough time left for the reason you chose medicine in the first place: your patients. But here's the good news. Healthcare virtual assistants are stepping in, and they're making a real difference. These aren't robots or automated voice menus. They're real people, trained in healthcare workflows, working remotely but supporting your team as if they were right there in the office. And the best part? They're not just improving your to-do list, they're improving patient care. Think about scheduling, for example. How many times has your staff been tied up on the phone, trying to manage appointments, cancellations, or follow-ups? Virtual medical assistants can take over that load. They handle calls, send reminders, rebook missed visits, and track follow-ups so patients don't slip through the cracks. The result? Happier patients, fewer no-shows, and a schedule that actually runs smoothly. Now let's talk insurance. We all know that prior authorizations and coverage checks can be a nightmare. A single case can waste hours of back and forth. With VMAs, that stress disappears. They verify coverage before visits, submit and track authorizations, and communicate directly with payers. Patients avoid surprise bills, providers avoid wasted time, and treatments aren't delayed by paperwork. Patient communication is another area where VMAs shine. Missed voicemails and delayed responses create frustration and erode trust. Virtual assistants can monitor patient messages, provide quick answers to routine questions, and escalate urgent issues right away. Patients feel heard, respected, and cared for, even outside of appointments. And let's not forget the front desk. Your staff are the unsung heroes of the practice. But when phones never stop ringing and insurance forms pile up, patients checking in don't get the attention they deserve. With VMAs handling the digital workload, your front office team can focus on what they do best: greeting patients warmly, checking them in smoothly, and creating a welcoming environment. That calm, professional atmosphere makes a huge difference in patient experience. Accuracy of care also improves. From updating EMRs and managing referrals to tracking chronic care programs, VMAs help ensure that documentation is precise and follow-ups are never missed. That means safer, more consistent care, and greater confidence in your data. But beyond all the efficiency gains, here's the bigger picture. Virtual medical assistants make care more human. By taking routine, repetitive tasks off your team's plate, they give doctors, nurses, and staff the breathing room to truly focus on patients. And that's what patients remember: the time, the attention, the trust. It's no wonder practices across the US are adopting VMAs. Rising staff burnout, growing patient expectations, financial pressures, and complex insurance requirements are pushing clinics to find smarter solutions. VMAs answer that call. They protect staff well-being, stabilize revenue, and most importantly, allow practices to deliver better care. So, what's the takeaway? Virtual medical assistants aren't just administrative helpers, they are partners in patient care. They streamline your practice, strengthen communication, reduce errors, create the space you need to reconnect with why you became a doctor. With VMAs, you don't just save time, you elevate care. Thanks for watching.